I am Dr. August and I'm going to be conducting a cranial nerve exam today. Okay, so just looking at your notes, I can see that you've been suffering with a little bit of tingling on the face. Okay.
Yeah, right here on my left side.
Okay, is it painful at all?
No, not painful.
Okay, and how long has that been going on for?
I noticed it first time when I started applying makeup with a sponge. If I dab my face, then I'll feel a little tingling sensation.
And does it stop as soon as you finish touching your face?
Usually it stops right away, yes.
Okay. Right. Just a couple of questions for you. Are you currently on any medication?
Yes, I'm on allergy medication, just over the counter.
Okay. And any recent surgeries on the face or upper body?
No surgeries, no.
Okay. Any recent injuries to the head at all?
No injuries to the head, absolutely not.
Okay. And recreational drugs and alcohol?
No recreational drugs. I do consume alcohol about once a week.
Okay. Caffeine intake?
Yes, I do drink coffee every day.
Okay. How many glasses a day or cups?
About 5 cups a day.
Okay. And any other kind of major illnesses in the family, such as multiple sclerosis, Bell's palsy, anything like that?
My dad passed away from pancreatic cancer.
Okay.
Other than that, no other major history. No.
I'm very sorry to hear that.
Thank you.
Alright, well, that all sounds very straightforward, okay? What I'm going to do is conduct the full 12 cranial nerve exam. I am going to focus slightly more on the facial nerve and the trigeminal nerve, which are responsible for sensation here and here. And I'm probably going to do a little bit more of a lengthy exam, especially on the head and the hairline, if that's okay.
Sounds great, thank you.
Alright, so. Okay. So, we are first going to start off with the oculomotor and the optic nerve. So I'm just going to pop some gloves on. Alright, so just going to have a quick look at the eyes to begin with. So there's no obvious swelling, good symmetrical shape, no redness, no cuts, lesions. You could just keep looking straight ahead. Okay. Alright, so I'm just going to ask you to face straight ahead, and we're going to look at the optic nerve, which is responsible for vision. Alright, so just want to check that there's no blind spots anywhere. So you can see this, there's no issues with your vision.
Yes.
All good?
Oh, good, yes.
Alright, so I'm going to ask you to just hold this over your eyes. Okay. Right, I'm going to ask you to just read out this bottom line.
PFCDTZP.
Okay, and if you could just swap to the other eye. Perfect. Alright, and this line, please.
DPCZLFT.
Perfect. Is the green or the red line more prominent for you there?
They look the same to me.
Okay, if you could just swap the eye. Again, is the green or the red more prominent?
The same.
Okay, that's great. Just take that for you. Okay, so just following my finger. Any double vision?
No.
Okay. Just tell me how many fingers?
2, 1, 3, 5, 1.
Okay.
1, 2, 3, 2, 3, 4.
Perfect. Just relax there for me. Alright, so as part of the oculomotor abducens and trochlear nerve, they look at eye movement. Okay, so I'm going to do a variety of tests that focus on your eye movement, pupil response and traction. Okay, so just looking straight ahead for me. First of all, I'm going to check your pupil response. Okay, really good pupil response there. Alright, so I'm just going to have a physical feel, okay? Okay, I'm just going to press on your eyes ever so slightly. Just tell me if there's any pain.
No pain, no. No pain.
Okay, and just relax. If you could just open your eyes. Okay, I'm just going to get you to any pain as I'm stretching those eye muscles.
No, no pain.
On this side.
No pain, no.
And
no.
and any pain there?
No, oh good.
Okay, just blink a few times for me. I'm now going to have a closer look. Okay, so just looking straight ahead. And if you could look down and then up. Down and then up. Right. The blood vessels, the capillaries in your eye are slightly inflamed. Okay, so they've risen to the surface quite a bit. Is this something that you have noticed before?
I wear contacts even right now, so usually yes, my eyes get dry.
Are those monthlies or dailies?
Monthlies.
Okay. So I might suggest speaking to your optician about switching to dailies. Much better for the hygiene of the eye. Okay. It may reduce some of the dryness and the capillaries which have risen to the surface slightly. Okay.
Sounds good, Anna. Thank you.
So. Any pain when I press into the tear ducts?
No.
Okay. Let's have a look. I'm going to get you to just look at the light. I'm just going to ask you to follow the light, okay? So, good eye tracking, very smooth. Okay, just blink a few times just to get some moisture back in the eyes. Okay, good. So I'm going to check your peripheral vision. So if you could look straight ahead and just tell me when you can no longer see my finger.
Now. 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 Now.
Okay, any pain, discomfort when gazing ahead, or any kind of discomfort at all?
No pain. No, maybe just my eyes are getting a little bit dry, but that's normal for me.
Okay, alright. We'll give your eyes a rest for the moment, okay?
Sounds good.
Alright, so while we're giving your eyes a rest, we're going to look at the olfactory nerve. And this nerve is responsible for smell, okay? So I'm going to have a little look inside your nose, if that's alright.
Yeah.
Okay. Okay, so just head back slightly. Okay, there's no visible obstructions. Okay, I'm going to ask you to close your eyes. I'm going to spray a scent, and I would like you to just tell me what you can smell.
It smells like lavender.
Okay, perfect. Again.
Orange.
Perfect, well done. Any pain?
No.
Any issues with your breathing, the nasal passages?
My nose gets runny sometimes. So that's about it. Other than that, nothing.
Okay, I'd probably put that down to the allergies that you mentioned. Okay. I'm going to take a nasal swab, if that's alright with you. We're going to send this off for testing, and it will just look at the bacteria that you've got in your nose, if there's any issues there, okay?
Sounds good.
So I'm just going to pop this in just here. Okay, and okay. So those results should be back in a couple of days, alright? Alright, so we're going to focus on the facial nerve and the trigeminal nerve. So the trigeminal nerve sits here, and the facial nerve has branches that spread across the face, okay? And it's responsible for movement and sensation across the face. So what I'll also do is look at the sensation of the head, okay? Because the facial nerves don't just stop here, okay? They run all the way back. Okay. So we're going to do a facial sensation test to begin with. Okay. So I'm just going to use this to do some tapping. So I'm looking for any tingling, numbness, pain, twitching, anything that feels abnormal?
No, nothing so far.
Okay, just trying to trigger anything here. Okay. So, you mentioned that there was tingling on this side. So, I'm just going to follow the facial nerve across the face and just tell me if you feel anything at all, okay, apart from the sensation. How does that feel?
Felt quite pleasant, nothing unpleasant.
I'm just going to ask you to compare both sides now. Anything there at all?
Same sensations on both sides.
Okay, if you could just tell me if the sensation is sharp or soft.
Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft and then sharp. Sharp then soft. Sharp and soft.
Perfect. Any pain here?
No.
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 Any shooting pains, sharp electric shock-like pains?
No.
What about now?
No, quite pleasant.
Now?
No.
No? Okay. Anything there?
No.
No?
No.
Okay. So I am going to just get you to open your mouth. I'm going to try and touch on the inside of the mouth to see if there's any kind of pain or if we can trigger any spatial sensations at all. Okay, so just open the mouth slightly. Any pain there?
No.
There? There?
No.
There?
No.
And up there?
No. No pain.
Alright. Okay, let's have a look at your hairline and scalp now. No lesions. No inflammation. Slight dandruff. Okay, I'm just looking for anything which might trigger any abnormal sensations or perhaps be causing shooting pains or the tingling that you're experiencing. So I'm just going to get you to look all the way. You're not feeling any electric shocks, are you, from this?
No.
Okay.
Oh, good. It's quite pleasant.
There is some static, so I just want to double check that that's not hurting you.
It's all good.
And I'm not triggering any pain, any tingling, any shooting pains.
No. It does feel tingly, but in a good way.
Okay. Causing some dandruff to come loose. Any pain?
No.
And just bend your head forwards. Any pain there?
No.
Head back. About now?
No pain.
Can you feel this?
Yes. 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 Yes.
Okay, perfect. Just still focusing on the facial nerve. Close your eyes, please. Okay, good. Good auditory reflex on the eyes, okay? If I could just have a look inside the mouth, just looking at good level of salivation. Close your eyes. Close your mouth, sorry. And now close your eyes. Try and open them. Okay. Close your eyes. Okay, so now I'm going to move on to your vestibular cochlear nerve. This is responsible for balance and hearing. So initially I'm going to have a little look inside the ear. Okay. Just lovely and clear, no wax build up. Do you clean your ears regularly?
Yes.
Okay, perfect. Good level of hair distribution. It's not inflamed or red, okay? Same for this side, very clean, good distribution of hair. It's not inflamed. Okay. Alright, can I just get you to tip your head from side to side? Any sensation of fluid in the ears?
No.
Okay. Can you hear this?
Yes.
And that?
Yes.
Okay. Just say left or right on which side you can hear the sound.
Right. Left. Left again. Right. Left.
Okay. You can hear this
Yes.
and this.
Yes.
Alright, just tell me if the sound is getting louder or quieter.
Quieter. Louder. 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 Quieter. Quieter again.
Can you hear the difference?
Yes, all around. Mm-hmm.
Right, I'm just going to ask you to say left or right and to which side you can hear it more.
Left side more. Right. Left. Right. Left. Bottom. Left.
Perfect. Okay, so now I'm going to look at your glossopharyngeal nerve, okay, which is responsible for sensation in the throat. It can sometimes come from the trigeminal nerves and sensation in the mouth, but we have nerves at the back of our throat as well, okay? So if I can get you to swallow. Any pain there?
No.
And please swallow again. Any pain?
No.
Okay. Okay, if you could just open your mouth for me. Okay. No lesions. No build-ups. Looks lovely and healthy. Okay, just relax. Okay, now the vagus nerve is one of the larger nerves of the body. Okay, it runs down. Okay, it's responsible for the cardiac organs, so your heart, and it's also responsible for some of the movements and sensations in the head. Okay. So what I'm going to do is I'm going to ask you to repeat some words. I'd just like you to say them as you hear them. Okay?
Yes.
Apple.
Apple.
Pineapple.
Pineapple.
Banana.
Banana.
ASMR.
ASMR.
Okay. Just keeping your head straight. Dog.
Dog.
Cat.
Cat.
Sun.
Sun.
Winter.
Winter.
Okay. If I can get you to just cough. And again. And again. Alright. Can you attempt to swallow with your mouth open? Okay. You find that quite challenging?
A little bit, yeah.
Okay. Okay. I'm going to have a little listen to your heart, your breathing now. Take your blood pressure. Okay.
Sounds good.
So let's do the blood pressure first. Okay, I'm just going to get you to relax. Okay, just want you to feel nice and relaxed. Just concentrate on your breathing. Nice and relaxed. Don't slow down the breathing, don't speed it up. Nice and relaxed. Okay, slightly elevated blood pressure. So we're going to do that one more time. Okay. And again, nice and relaxed. Just rest. Okay, there we go. Much better. Well done. Got very normal blood pressure, healthy heart. Okay.
Thank you.
I'm going to listen to your heart now with the stethoscope. Can I just pop this here?
Mm-hmm. Okay, that's great.
nice and healthy heartbeat. Just going to have a little listen to how many breaths per minute you do. So just relax your arm. I'm going to ask you to just breathe normally. Please don't speed up the breathing or slow them down. I'm just going to have a listen. Okay, nice and slow breathing, right? Okay, now I'm going to just have a focus now on the accessory nerve. Okay, so please shrug and relax, and again. Okay, relax. Please turn your head to the left and then the other way, and look up to the ceiling and down and back to the centre. Please turn your head this way. Try and turn it back. Alright, and look the other way. And try and turn it back. Okay, perfect. I can get you to just hold your hands out like that. Like that. And I'm going to now try and close your fingers. Okay. Alright, that's great. You just push against me. Perfect. And one hand. And the other side. Perfect. Okay, can I get you to just stick your tongue out for me? Alright, and push it back in. And now open your mouth. Please move your tongue side to side and then up and down. Okay, relax your mouth. Alright, I don't think I have missed anything. Okay. So all of the cranial nerves are very healthy, okay? There's no issues, there's no damage, there's nothing that worries me at all. We did go through all of them. We did a very detailed facial nerve test, and I didn't manage to stimulate any tingling or numbness. What I would suggest is that you reduce your caffeine intake, okay? Tingling is a very normal sensation. It can just happen to people, alright? What I would suggest is reducing the amount of coffee you're drinking each day. How many glasses did you say you were having?
About 5 every day.
Okay, so I would probably say for a woman 2 max, alright? It's a lot of caffeine. Okay, there is an argument that caffeine can be beneficial to the vascular system, but 5 or 6 cups you're going to be struggling, maybe putting a little bit of pressure on the heart. Okay.
Yeah, too much. Definitely, I'll cut that down.
Yeah, that would be great. I'm going to suggest you come back in 6 months and we redo the tests, okay?
Yes.
We can see if there's any difference there.
Sounds good, I'll be here.
Okay, perfect. Well, hopefully I don't see you before then and you stay nice and healthy. But otherwise, I look forward to seeing you again soon.
Thank you so much, Dr. August.
Okay, thank you. August is my name, and the 1st of August is my birth date.
August, yes, I do remember you from our last head-to-toe assessment. So what brings me today, August?
So I think I've injured like my shoulder or one of the muscles coming off of it. Okay. I was walking the dogs and then they suddenly jolted and my arm like went forward like that. And I also fell over.
Okay.
I managed to catch myself, but I did still hit my head. It's like here.
Over here?
Yeah.
Okay. when did this happen?
2 days ago.
2 days. And on a scale of 1 to 10, how would you rate your pain today?
Today it's a lot worse. I would say like a 7.
7, okay.
It didn't initially hurt. It's like it's getting worse each day.
And how would you describe the pain right now in your shoulder and in your head?
If I keep really still, I don't really feel too much, but any slight movement, it's like a pulling kind of pain, like the muscles like damaged or something.
I'm so sorry to hear about that. That must have been scary.
Yeah.
Have you tried any over-the-counter medication for the pain?
I took ibuprofen.
Okay.
But that's it. I don't really like to take medication.
Do you remember how many pills you took? How many milligrams?
It was 500 milligrams.
Okay.
Yeah.
Have you tried any cold packs or ice packs on the shoulder? Okay. Sounds good. So what I'm going to do today is perform a very quick cranial nerve exam to make sure that everything is okay after the fall that you had. And then I'll take a look at your shoulder and examine your shoulder, your neck, and your head.
Okay.
So I'm just going to put on my gloves, take your vital signs first, and then we'll begin the exam.
Okay.
And just quickly checking your mental acuity. Do you know where you are today?
Yeah, I'm in the clinic.
Very good. And do you remember my name from our last examination?
Luna Lux.
That's right. Very good. So mental acuity checks out today. Do you feel any tingling sensations in your arms, your neck, your face?
A little bit on this side, like the back of my head here.
Over here?
Yeah.
And how about the rest of your back? Do you feel any pain in your upper back, lower back?
Just on this side, the pain from the shoulder.
Okay, just over here.
Yeah.
Alright. So I'm going to begin by taking your temperature first.
Okay.
You can just close your eyes and relax for me. This is going to go over your forehead, behind your ear. 97.5. Very good, you do not have a fever. Any flu-like symptoms in the last 2 weeks?
No, I just have a little bit of an itchy nose from hay fever.
Oh, okay. It's okay, we all struggle with that. I have allergies myself.
Okay.
Right, so I'm going to take a listen to your heart. Is it okay if I slide this under your shirt?
Yeah.
Okay. You can just breathe normally for me. I'm just going to listen to your heart for any murmurs or any abnormalities coming from your ventricular muscles. Clean, clear sound. No signs of any murmurs or abnormal beats. I'm going to listen to your lungs next. Take a deep breath in for me. And out. Deep breath in. And out. Okay, you can just breathe normally now. Okay. No signs of any bronchitis, pneumonia, or infiltrates. Okay. Let's check your levels of oxygenation and your pulse. So please have your index finger. Just relax and take a deep breath in for me. Excellent. 80 beats per minute and about 99% oxygenation, which is very good. Right, I'm also going to check your blood pressure. Is it okay if we do it on this arm, even though it's the one that's hurting you?
Yeah, that's fine.
Okay. You can just slide this in here, and I won't close it too tight. And you can just put your hand under my armpit, and if you could hold this for me. And make sure you uncross your legs and just relax. Okay, 130/60, a little bit elevated. Could be because of the pain that you're feeling, so I'm not too concerned.
Okay.
All right, August. So I'm going to quickly check all 12 of your cranial nerves right now. Can you look at me and puff out your cheeks for me? Keep them puffed. Don't let me unpuff them. Very good. Raise your eyebrows as high as they go. Don't let me lower them. Very good. Close your eyes. I'm going to attempt to open them. Don't let me do that. Very good. I'm going to try to move your head side to side. Don't let me do that. And on the other side. Very good. I'm going to attempt to push your head back. Don't let me do that. And forward. Don't let me do that. Very good. Now give me a wide smile. Very good. And a frown. Excellent. Open your mouth for me. And can you move your tongue side to side? Can you try to push your tongue through your cheek right here? Very good. And on the other side. Excellent. Right, so far so good. I'm going to check your eyes next. Can you look at the tip of my nose? I'm going to check your pupil response. And from above and across. Very good. Excellent pupil response. Can you cover one of your eyes and try to look at the tip of my nose and count how many fingers I'm holding up?
2, 1, 5, 2.
Excellent. Okay. Switch eyes. Continue looking right here.
1, 2, 5, 1.
Excellent. Now, continuing with checking the cranial nerves that control the movement of your eyes. Can you try to keep your head steady for me and look at the light? Continue keeping your head steady and look at the light. Then my fingers over here. The light again. My fingers. The light. My fingers. Very good. Now continue keeping your head steady and just look at the light and follow it. I'm going to check your eye mobility. Eyes are moving together, synchronized movements. Any double vision right here?
No.
How about here?
No.
Very good. So no concern whatsoever with the mobility of your eyes. I'm going to do what's called the lid lag test next. Continue keeping your head straight and look right here, and I'm going to drop my light really fast down. Try to follow it. And one more time. Very good. No lid lag noticed. Have you ever noticed any problems with your smell or your taste?
Only when my nose is blocked.
Only when it's blocked, okay. So I'm going to give you something to smell. Let's see if you can identify the smell.
Okay. Rosemary.
That's right, rosemary. Well done. Right, next up I'm going to check the sensations on your face. Can you please tell me if you feel this equally on both sides of your face?
Yeah.
Equally on both sides of your cheeks?
Yeah.
And equally on both sides of your neckline?
Yeah.
Excellent. Right, I'm going to check your ears next and your hearing. Have you noticed any abnormal sounds, especially after the fall that you had?
No.
No. Any headaches that come and go and don't go away other than?
Yeah, I get aura migraines.
Migraines, okay. Has it gotten worse since the fall?
I've had one since the fall and I usually don't get them that often.
Okay. Alright, so I'm going to just palpate your ears really quickly. Do you have any pain right now in your ears?
No.
Okay, continue keeping your eyes closed and tell me if you hear this.
Yeah.
And where do you hear this?
In front.
In front of you. How about this?
Below.
Okay. And can you tell me if you hear this sound clockwise or counterclockwise?
Anti-clockwise.
From your perspective, very good. And can you tell me if this is getting louder or quieter?
Louder.
How about this one?
Quieter.
Very good. And this one?
About the same. Quieter.
Very good.
Louder.
Excellent. So no concerns whatsoever with the sense of hearing or your ears.
Okay.
Alright, next up, August, I'd like to check your sense of taste. Have you noticed anything out of the ordinary with your taste recently? No. Okay. Any dryness in the mouth?
No.
No. Okay. So can you please stick out your tongue for me? And tell me, what does that taste like?
Salt.
Salty. Very good. Is it okay if I come close and palpate your head?
Yeah.
Alright, you can just keep your eyes closed and relax. And you said that you hurt yourself right about here. Okay. I'll try to avoid that area when I palpate. Is it okay if we remove your ponytail?
Yeah.
Okay, your head is symmetric, no lumps or bumps. Any pain right here at the top of the spine?
No.
Pressing down on your mastoid bone. Any pain here?
A little bit.
A little bit, okay. I have a resident dog in the clinic, so those are the sounds that you may be hearing while your eyes are closed. Right, not noting anything of concern with your head. No lumps or bumps. No abnormal masses. I'm going to focus on your face and the area that you mentioned that you had your fall on. Not noting any lesions, lumps, or bumps where you hit your head. No blues or grayish colors. Your face looks very well perfused. The color of your neck blends well with the color of the skin on your face as well as your scalp. No abnormal discharges from your ear. Normal ear oracle. And let me take a look over on this side as well. Make sure that I'm not missing anything that may indicate a more underlying systemic problem. Okay, I'm going to palpate your jaw next and just feel the bone underneath and your lymph nodes. No lymph node enlargement noted. Not feeling anything abnormal upon palpation. Okay, I'm also going to make sure that your cranial bones are intact. And I'll use here my medical hammer to tap lightly on your face. Let me know if you feel any discomfort. Good. I'm also going to do a quick skin check to make sure that I'm not missing any micro lesions, especially on the side of the face and head that you hit. Continue keeping your eyes closed for me and just relax. I'm just going to check your skin very in depth. Make sure that there are no micro lesions, blue or grayish colors. You can move your head over that way for me. Just going to very thoroughly check the area that you hit. Not noting anything abnormal. And also within your hairline over here. Just making sure that there are no bruises that are hiding under your hairline, which looks very healthy. Most excellent. So I'm not concerned at all with this side of the head that you hit. I'm going to focus on your shoulder next.
Okay.
Alright, August, so I wasn't able to find anything wrong with your head, your face, all 12 of your cranial nerves. I'm going to focus on your neck and your shoulder next.
Okay.
Is it okay if I move the hair out of the way? Alright, let's just... I'm just going to do a visual inspection first. Just take a look at your neck. You can keep your eyes closed and relax. Just breathe normally. Just looking at your skin. Seeing if I can pinpoint any external signs of anything that I may have missed in the previous exam. Normal skin color, no blues or grays, no external signs of any lesions. Okay, I'm going to compare the two shoulders now. They're about the same elevation. So it all looks normal visually. I'm going to just palpate the area. Not feeling any lumps or bumps, no signs of any inflammation. Normal pulse. Pressing down on your scapula in the back. Do you feel any discomfort?
Yeah.
On a scale of 1 to 10?
6.
6, okay. Touching your clavicle in the front. Any pain right here? Okay, clavicle feels intact. Can you move your hand up for me and then lower back down? Just listening for any clicking sounds. I'm not hearing anything. I'm also going to listen with my stethoscope. Let's repeat one more time. Hand up, laterally, and down. Okay. I was not able to hear any clicking sounds or no signs of any crepitus, which is very good for your rotator cuff. Very good news. I'm going to do just a more thorough skin inspection of your shoulder as well. Make sure I'm not missing any micro lesions. Checking your scapula in the back as well. No micro lesions or discoloration. From the top of your spine to your shoulder, 9.54. From one shoulder to the other, 19.15. From the top of your head to the shoulder, 16.152. From the top of your head to your neck, 12.15. Measuring your clavicle in the front, 7.152. From the top of your shoulder to your elbow, 14.12. And across your rotator cuff, 8.925. I'm going to do some light acupressure next and press on some of the most important points in your shoulder joint and your upper back and release some of the tension. Was this painful?
Yeah.
Okay, I'll be lighter over here. I have here a tuning fork. I'm going to strike it and cause some vibrations. And I'll place it on the bony prominences of your shoulder joint. And you should feel it, but let me know if you don't.
I don't feel it.
You don't? So some loss of sensation over at the tip of your shoulder. Okay, let's try that again. A little bit harder. Do you feel this one now?
I feel it a little bit more, yeah.
That's good. Okay. So it means that the nerves do work, but most likely they were damaged a little bit. Could be from the internal inflammation going on in your rotator cuff. Do you feel this?
Yeah.
How about this one?
Yeah. 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 Yeah.
The vibrations are also healing. They will stimulate the blood flow in the area and direct your energy towards the damaged area over here. Hopefully promote healing. Do you hear this?
Yeah.
Very good. Let's also do a quick skin sensations test over in this area here where you mentioned that you couldn't quite feel the vibrations.
Okay.
Can you tell me if you feel this?
It was very light.
Very light. How about this?
Yeah, I can feel that.
Okay. Can you tell me if that was sharp or dull?
Can you do it again? Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp.
Very good. So I'm not concerned with the nerves in your body. There seems to be no nerve damage from your fall and from the accident that you had with the dogs. I'm going to perform a quick massage and see if I can help you relieve some of the pain. Just going to apply some coconut oil and lubricate the area. Just gonna move your hair out of the way, not to get any oil on it, even though it's very healthy for the hair as well. Okay, August. So I did a very thorough examination of all 12 of your cranial nerves, your head, your neck, your shoulder. I'm not able to find anything that would require you to undergo further treatment. I think you damaged your rotator cuff during the accident that you had with your dogs. It's a mild inflammation that I was able to detect, so it should go away in about a week or so.
Okay.
Make sure to immobilize the arm. Definitely don't work out, don't lift any weights. Try to keep it as immobile as possible.
Okay. Thank you.
Nice seeing you again today.
Thanks so much.
May I please have your first name and date of birth?
I have August.
August.
And the 1st of August.
1st of August, yes, of course. Thank you so much. So you're interested in a head-to-toe assessment. Have you ever had that done before, August?
I think I had one last year.
Last year. Okay, and is there anything in particular that you are concerned about regarding your health?
Sometimes I have heart palpitations.
Heart palpitations. All right. And do you have any allergies?
Cats and
Cats.
hay fever.
Cats and hay fever. All right. Any blurred vision or double vision?
I had like flashing, black and white flashing 2 weeks ago.
Right. Any difficulty breathing, August?
I have asthma.
Asthma, okay. And have you always had that?
Yeah.
Are you allergic to any medication?
No.
No allergies, okay. Sounds good. So I'll be more than happy to be your doctor today and perform a very thorough physical assessment starting from your head all the way down to your toes. Do you have any questions for me, August?
No.
Wonderful. I'm just going to put on my gloves and we can begin the assessment. And what I usually like to do with all of my patients is also assess their mental acuity. So do you know what day of the week is today?
Tuesday.
Tuesday, that's right. And do you know where you are?
Yeah.
Where are you?
In the doctor's clinic.
The doctor's clinic. Alright. So what I'm going to do, August, is I'm going to listen to your heart and your lungs. This is just a little bit cold, so I do apologize. Is it okay if I slide it in your shirt? Just take a deep breath in for me and relax. I'll be looking for any murmurs. I'm not able to hear S3 and S4. I'm hearing S1 and S2. Very good. Okay, I'm hearing steady rhythm, no extra sounds. I'm also going to listen with the bell side. Excellent. Okay, I'm going to listen to your lungs next, and I want you to take a deep breath in every time I touch you with the stethoscope. Okay, deep breath in and out. In and out. No signs of pneumonia or infiltrates. No wheezing. Okay, very good. I'm also going to listen to the back. Take a deep breath in for me and out. Excellent. So I'm hearing very clear, clean sounds coming from your lungs.
I feel a little bit lightheaded.
Okay. So you mentioned that you feel a little lightheaded. Would you like some water?
I should be alright. I think it's just because I was breathing quite a lot.
Okay. Do you usually do any breathing exercises?
Sometimes I do like meditation.
That's very good. Does it help you?
Yeah.
Very good. Continue doing that. Okay, what I'm going to do next is take your temperature. Have you had any flu-like symptoms in the last 2 weeks?
No.
Okay. So this is going to go over your forehead and behind your ear. 98.5, excellent. You do not have a fever. I'm also going to check your pulse electronically and check the levels of oxygenations in your blood. May I please have your index finger? Just relax for me. Take a deep breath in. Excellent. So 98% oxygenation and about 80 beats per minute. So you're very relaxed and everything looks okay. Next up, I'd also like to check your blood pressure. Have you ever had this done before, August?
Yeah.
Okay. Do you have an arm preference?
No.
Okay, let's do the right one then. Just going to slide this one in. Could you please hold this one for me? And if you can just slide your hand right here. Excellent. So I read about 120/60, which is a very good blood pressure. Before we proceed any further, I'd like to also take a couple of measurements of the circumference of your head and your face. So just relax for me. Going to take a note of the measurements I just took and your vitals. So normal temperature and blood pressure, good levels of blood oxygenation, normal lung and heart sounds. No flu-like symptoms in the last 2 weeks. Very good. Next up, I'd like to focus on your head and palpate, and I'll be looking for any lumps or bumps, anything that feels abnormal. Okay, you can just close your eyes and relax. Pressing down on your mastoid process behind your ear. Do you feel any pain right there?
No.
Your head is symmetric. I'm not feeling any lumps or bumps. Okay, I'm going to check your jaw and your lymph nodes. No lymph node enlargement noted. Trachea is midline. Thyroid gland is barely palpable, which is what we want. No lumps or bumps.
I forgot to mention that I have an underactive thyroid.
Oh, okay. Are you taking any medication for
Yeah.
that? Okay, your thyroid looks okay as of right now, but it's good to note that so we can keep track of it. Excellent. Alright, next up, I'd like to check your scalp and check for any potential infestation, psoriasis, ringworm, any abnormalities of the scalp.
Okay.
So I'm seeing an even hair distribution, no signs of psoriasis. The color of your scalp blends well with the color on your face and your neck. No dandruff. Very good. This side looks perfectly healthy. I'm going to focus on the other one as well. And just relax. Right, August, so your scalp, your head looks perfectly healthy. I'm going to focus on your face next. Have you ever felt any pain in your face or any problems?
No.
No? Okay. So just by looking at you in normal light condition, I see that your face is symmetric, your pupils are round and reactive to light. They have the normal size and shape. Your face looks to have the normal color, good symmetry. Your eyelids are opening and closing symmetrically. So, is it okay if I come close and touch your face?
Yeah.
So I'll be feeling for any lumps or bumps or anything abnormal. I'm gonna just look at my light as well. Not noting any lesions or lumps, no bruises. Alright, that looks perfectly healthy. Going to lightly tap on your face. Let me know if you feel any pain or discomfort. Good. Next up, I'm going to do a facial sensations test. So I'll be evaluating how well the nerves that control, your face work. Okay. Can you please close your eyes and tell me where I'm touching you? Forehead.
Chin. Nose. Both cheeks. Lip.
And what now?
My ears.
Very good.
Under my chin, my neck.
And do you feel this equally on both sides of your forehead?
Yes.
Good. V1 is clear. Equally on both sides of your cheeks?
Yep.
V2 is clear. Equally both sides of your jawline?
Yep.
V3 is clear. Very good. Next up, I'm going to ask you to tell me which side of my instrument I'm tapping you with, sharp or dull. Okay, keep your eyes closed and tell me if it's sharp or dull.
Can you do that one again?
Sure.
Sharp.
That's right.
Dull.
Dull. Very good.
Sharp. Dull. Dull.
Very good. Now can you look at me and puff out your cheeks for me? Keep them puffed, don't let me unpuff them. Good. And I'm going to attempt to move your head side to side. Don't let me do that, resist that motion. Very good, and the other one. Very good. Raise your eyebrows for me, high up. Keep them raised, don't let me lower them. Very good. And open your mouth wide and move your tongue side to side, up and down. Excellent. Okay. Next up, I'm going to focus on your eyes. Can you look at my nose? I'm going to quickly flash my light in your eyes to check your pupil response. So it's only going to be just a second. And across. Very good. Pupils are round, reactive to my light. That looks very healthy as of right now. Keep your head steady and look into my eyes and try not to break eye contact. And mirror me, touch your nose. And now I want you to continue looking in my eyes and touch my finger with your finger back to your nose. Very good. Touch my finger, back to your nose. Finger, nose, my finger, and your nose. Very good. So good hand-eye coordination. Now I want you to follow my finger. So look right here. Try to keep your head steady, not move it. And look at my finger and just follow it. I'll be checking for your binocular vision and progressively getting closer to you. Any double vision right here?
No.
And how about right here?
No.
Excellent. So your binocular vision is intact. Can you look up for me? Yeah, look up. I just want to take a look at the base of your eye. No jaundice, no popped vessel. Very good. And now look down for me. Alright, August, next up I'm going to evaluate your optic nerve. I have here an ophthalmoscope, and this is going to allow me to visualize your cornea and assess the health of your optic nerve. If you can look in the distance for me and just relax. Unfortunately, I'm going to have to shine another light in your eyes, okay? Just for a second. Optic nerve is intact on your right side. No cornea scratches, no signs of concern. I'm going to take a look at the other one as well. Alright, continue looking in the distance for me. I'm going to repeat the test over on this side as well. And look up for me. Look down, left and right. No cornea scratches or tears. Most excellent. Alright, August, I'm going to check how well you know your colors. Can you tell me what color is this?
Blue.
Blue. How about this one?
Green.
And how about this one?
Yellow. Red.
Very good. You're able to detect all four basic colors very well. Now, can you please follow the yellow object for me? Okay, I'm going to assess your eye mobility. Eyes are moving together, synchronized movements. Now, can you please look at the right object and continue looking at the right object, and don't break eye contact. Very good. Next up, I'm also going to do a vision test. I have here what's called the Snellen chart. Can you please read this line over here for me?
LT.
And how about this last one?
LTFPH.
Can you cover one eye? And read this one.
OLCF.
And can you cover the other one? And read the second to last row.
CFDHJ.
Very good. So your vision is 20/20, no signs of any concern. Going to focus on your ears next. Have you ever noticed any abnormal sounds, any problems with your ear?
No.
Any tinnitus?
No.
Any discharge, infections that don't go away?
No.
Okay. Is it okay if I come close and touch your ears? Alright, let's move the hair out of the way. And I'm just going to palpate your ears and look for any lumps or bumps and check for your pain when I pull down. Any pain?
No.
Any pain when I pinch up?
No.
Okay, very good. Most excellent. If you can look over to your left, please. Just going to take a look at the outside of your ear. Inspect your ear auricle. Normal color, no discharge. And next up, I'm going to look inside your ear with my otoscope. Continue looking to your left. Okay, I'm able to visualize your ear canal. No discharge. Normal tympanic membrane. Pearly gray color. Well-defined margins. Most excellent. Alright, I'm going to repeat the same test on the other ear. Alright, August, I'm going to do the same on your left ear as well. If you can look over to your right and relax for me. No signs of any infection or inflammation. Normal tympanic membrane. Well-defined margins, pearly gray color. Excellent. Right, August, I'm going to check your hearing next. Can you close your eyes for me? I'm going to whisper some words in your ear. Repeat them back to me. August ASMR.
August ASMR.
Luna
Luna Lux
Lux ASMR.
ASMR.
Tingles.
Tingles. Personal attention.
Very good. continue keeping your eyes closed. I'm going to make a series of clicks. Can you please count how many you hear?
2, 2, 1, 3.
Okay. Now can you please tell me when you stop hearing the noise?
Now. 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 Now.
Very good. Alright, I have here a tuning fork. I'm going to strike it and cause a vibration, and I'll place it in 2 different positions next to your ear.
Okay.
This will be position 1 and position 2. Tell me which one is louder.
Okay.
Position 1 and 2.
2.
2, definitely. Okay, I'm going to repeat the same test on your other ear. Position 1 and 2.
1.
Very good. Alright, August. Alright, August. Next up, I'm going to focus on your nose. Have you ever had any trouble smelling?
No, but I have very small nasal passages, so I have to breathe through my mouth a lot.
Oh, okay. And does that affect you negatively a lot?
It makes my hay fever worse.
Okay.
And sometimes if I have bad asthma, it makes me struggle to breathe.
Alright, I'm so sorry about that. If I can do anything to help you, we can definitely explore some options.
Thank you.
Right, is it okay if I palpate your nose?
Yeah.
Alright, I'll be feeling for any lumps or bumps. Pressing down on your sinuses. Any discomfort?
No.
No, you do have very small nasal passages. Yeah, you're right. Any pain right here?
No.
Okay. I'm gonna take a look inside your nose. No nasal obstruction noted. No inflammation or discharge. Gonna check the other ear as well. No nasal obstruction, and again, no signs of any discharge or inflammation. I'm gonna give you something to smell, just to test your sense of smell. Can you please try to identify this?
Coffee.
Coffee, yes, very good. And can you please obstruct one of your nares? And try to identify the smell.
Lavender.
Lavender, yes. And can you please obstruct the other nair? And I have here a different smell. Can you please identify it?
Sorry, I'm gonna sneeze.
It's okay.
That was citrus.
Citrus, yes, very good. So everything checks out with your nose. So I'm happy to report that everything checks out with your nose. There are no signs of any concern externally, internally, as well as with the cranial nerve that controls your sense of smell. I'll focus on your mouth next.
Okay.
Have you ever noticed any abnormal tastes, any mixing of the tastes?
No.
No? Good. Alright, so I'd like to just check the back of your throat for any potential signs of an infection. You can open your mouth wide for me, say ah.
Ah.
Definitely all clear. Alright, I'm also going to check your sense of taste. I'll give you an essence. And please try to identify the taste. If you can stick out your tongue for me.
Chamomile.
Chamomile, very good. And one other essence.
Apple.
Apple, very good. So everything checks out with all 12 of the cranial nerves that control the movements of your face, your 5 senses. I'd like to inspect your arms next, your tummy and your legs. Okay. Alright, can you please extend your arms for me? Alright. Can you keep them steady? No tremor noted. Excellent. Let me inspect the palms. No signs of any edema. Do you feel any discomfort when I'm palpating your arms?
No.
Palmar creases is not pale. No signs of any palmar erythema or red palms. Capillary refills within 2 seconds. No signs of nail pitting or nail clubbing. No signs of psoriasis or redness. Normal skin temperature and color. Please have the other arm as well. Normal color and skin temperature. No excess sweating. Can you please place your palm up? Capillary refills within 2 seconds, which is normal. No signs of palmar erythema. Very good. Alright, is it okay if you lay down now so I can inspect your tummy?
Yeah.
Alright, August. You can just place your arms around your body. Is it okay if I lift up the shirt and expose your abdomen? Yeah. Okay. Alright. So I'll start by doing a light palpation first. You can just relax and let me know if you feel any pain. Just starting off with a light palpation, not to disturb any homeostasis that could be going on with your internal organs. Checking for any masses or lumps. I'm going to do a light percussion next. Let me know if you feel any discomfort. I'm hearing excellent resonant sounds coming from your internal organs, which is a very good sign. I'm going to listen with my stethoscope next. This is a little bit cold, so I do apologize. You can just breathe normally. I'm able to hear activity in all 4 quadrants, normal tummy activity, no gurgling or swooshing sound. All normal sounds. Very good. Right, I'm also going to take a couple of measurements since you're laying down. Continue relaxing for me. 37.8. Very good, August. I'm going to focus on your legs next. Alright, August, I'm going to check your legs. Do you have any pain right now?
No.
No? Okay. Just going to palpate your legs slightly and check for any signs of edema. Normal skin temperature, no excess sweating. Patient doesn't note any pain upon palpation. So this leg is all good. I'm going to palpate this one as well. Any discomfort right now?
No.
Do you feel any pain in your knees?
No.
Very good. Normal skin temperature on this leg as well. No excess sweating. Going to check your reflexes. Okay. Very good. Going to palpate the plantar region of your right foot. Let me know if you feel any pain or discomfort. Alright. Over on this one as well. Pedal pulse is 2+. Going to compare it with the pedal pulse on your other leg. They are synchronized. And no pain is noted upon palpation. Okay, can you please tell me which leg I'm touching you, left or right?
Right. Left.
And can you please tell me if this is sharp or dull?
Sharp.
And how about this one?
Dull.
Very good. Alright, August, you can come back up now. Alright, August, so I did a very thorough examination of your whole body, starting from your head all the way down to your toes. I was not able to find anything abnormal. Do you have any questions for me?
No.
Alright. Thank you so much for allowing me to do this assessment on you today, and I hope to see you again soon.
Thank you.